Hi, may I come in?
Yes, come in.
Perfect. My name is Angela. I'm going to wash my hands. I will be your student nurse today. Today I'm going to be conducting a head-to-toe assessment, which should only take about 15 minutes, investigating the different systems in your body through inspection, palpitation, and percussion, stuff like that. Do you have any questions?
No.
No? Sounds good. Thank you. Do you mind if I verify your name and your date of birth?
Yeah. JC, January 31st, 2004.
Perfect. Next I'm going to ask you a couple of questions such as, do you know where you are?
Yeah, I'm in the apartment.
Perfect. Do you know why you're here?
It's for a head-to-toe assessment.
Yes. And is it morning or night?
Night.
Perfect. Patient is ANO times 4. Next, I'm going to ask you if you're in any pain today.
Just a little bit.
Just a little bit? Where would that be located?
On my back.
On your back? Would it be like lower, upper, middle?
Lower.
Lower? Does that radiate anywhere else?
No.
No? And how long does that usually last?
A couple hours.
A couple hours? And how long has this been persistent?
2 years.
2 years. What makes it better or worse?
Laying down or a heating pad.
Laying down or a heating pad. Can you just characterize the pain?
It's dull.
Dull. And do you know, maybe on a scale from 0 to 10, 0 being not hurting at all, 10 being the worst, where would you rate that pain?
4.
A 4? Sounds good. So I'll look more into that later once I get to your back. Yeah, I'm gonna go ask you to look forward for me, and I'm gonna go check your pupillary reflex. I'm gonna place my hand in on the bridge of your nose. Ooh, yeah, there we go. Perfect. Next, I'm gonna ask you to follow my finger with just your eyes. So again, one more time. And perfect. Perla and EOMS is intact. Next, I'm going to ask you to face this way. I'm going to feel your ears, okay? And I'm also going to inspect it. Pull your hair back. Do this. I'm going to check in. Good. Did you feel, when I do this, do you feel any tenderness?
No.
No? Sounds good. I'm going to do the other side. I'm going to pull this back. Good. I'm going to palpate again. Do you feel any numbness or tenderness?
No.
No? Sounds good. Their EACs are clear, not tender to palpate. Your hearing is intact with no drainage noted. I'm going to ask you to take your nose and pull it back for me. Good. No, there are no external lesions. Your mucosa is non-inflamed and is moist. Septum midline, your septum is midline and turbinates without hypertrophy. Next, I'm going to ask you to go stick out your tongue and open your mouth and say, ah.
Ah.
Good. Uvula rises with phonation. The mucous membranes are moist with no mucosal lesions. No thrashes and tonsils can be characterized as grade 1. Next, I'm going to feel your head. Let me know if you feel any tenderness when I palpate, okay? You feel anything?
No.
Perfect. Your head is normocephalic, atraumatic, no visible or palpable masses. Yeah. Next, I'm going to be looking at your lungs. Before I do that, I'm gonna do this. I'm gonna wash my stethoscope, and I would have done this on the skin, but for the purposes of today, I'm gonna go through your shirt. So first, I'm gonna ask you to turn around this way, and I'm gonna ask you to take a deep breath when you feel my hands, okay? Perfect. Next, I'm gonna percuss. I'm gonna be just tapping on you. All right. Left upper lobe. Right upper lobe. Left upper lobe. Right upper lobe. The space between your left and middle lobe. Or I meant left and lower lobe. Right middle lobe. Left lower lobe. Right lower lobe. And left lower lobe once more. And your right lower lobe. Perfect. The sound changed from resonant to tympanic upon percussion. And at rest, the diaphragm rises to the level of the 4th intercostal space on the right and the 5th intercostal space on the left. Resonance is normal upon percussion of all lung fields. Next, I'm going to be listening to your lungs. All right, first, I'm gonna start off with your right upper lobe. Right upper lobe. And take a deep breath every time you feel my stethoscope. Good. Left upper lobe. Good. Right upper lobe. Good. Left upper lobe. Right middle lobe.
She's reading my horoscope.
Space between your left upper and lower lobe. All right, and then your right lower lobe. Left lower lobe. Right lower lobe. And your left lower lobe. Next, I'm going to listen to the side, so I'm going to raise this. Right middle lobe. Take it. Good. Next, I'm going to listen to the space in between your left and... Oh, let me listen to the other side. Sorry, one more time. Good. Next, I'm going to listen to the space between your left upper and lower lobe. Good. Next, I'm going to ask you to turn around for me real quick, and I'm going to listen to the back. I'm just going to be repeating the same thing. Right upper lobe. Left upper lobe. Good. Right upper lobe. Left upper lobe. Right middle lobe. The space between your left upper and lower lobe. Right lower lobe. And your left lower lobe. Perfect. Your lung sounds are clear with good, your breathing is unlabored and even. Diaphragmatic excursion at 5 centimeters and your chest expansion is symmetrical. Your chest wall is also symmetric without deformity and is atraumatic in appearance through your clothes. Next, I'm going to be listening to your heart. I'm going to first feel for your apical pulse. I'm going to ask you to, I'm going to place my finger right here, and then I'm going to ask you to lean forward. Perfect. Next, I'm going to listen once more, first on my diaphragm side, to your aortic valve. Aortic valve. Your pulmonary valve. Good. Your tricuspid valve. And then I'm going to ask you to lift up real quick, and to your mitral valve. Perfect. Next, I'm going to switch from my diaphragm to my bell side. I'm going to listen to your aortic valve. Good. Pulmonary valve. Good. Tricuspid valve. Good. And then I'm going to do this one more time for your mitral valve. Good. All right. Your PMI is not visible and is palpated in the left fifth intercostal. And at the MCT, regular rate, heart rate and rhythm is noted with no murmurs, gallops, or rubs upon auscultation. S1 and S2 sounds are heard of normal intensity. Next, I'm going to inspect your abdomen if you don't mind laying down for me real quick. Perfect. I'm going to ask you to pull up your shirt real quick. Good. Abdomen is flat and symmetrical. Next, I'm going to ask you I'm going to percuss your abdomen, starting off with your right lower quadrant. Right upper quadrant. Perfect. Left upper quadrant. and your left lower quadrant. Perfect. Next, I'm going to listen to your bowel sounds. All right, starting off with your right upper lower quadrant. Good. Right upper quadrant. Good. Left upper quadrant. And your left lower quadrant. Perfect. Lastly, I'm going to ask you to bend your knees for me real quick. And I'm going to palpate. Let me know if you feel any tenderness, all right? No tenderness?
No.
All right, and I'm doing the snake method, so I'm going to be going vertically. No tenderness?
No.
Perfect. All right, perfect. You can go ahead and sit back up. And when was your last bowel movement?
This morning.
Perfect. So it was tympanic upon percussion. Normal active bowel sounds were heard. And upon percussion, it was tympanic throughout all quadrants. Next, I'm going to be testing your extremities. So I'm going to be taking your radial pulse. Thank you. Perfect. That is 2 plus bilateral, or radial pulses are 2 plus bilaterally. I'm going to ask you to turn this way. I'm going to pull your skin up. Good skin turgor. I'm going to feel this. Perfect. No pitting edema. I'm going to ask to see this. And cap refill time is less than 3 seconds. Next, I'm going to ask you to grip my fingers. Perfect. I'm going to ask you to go like this. And do you mind pulling or pushing? And pulling. Oh, switch it. Perfect. Upper extremities are 5 out of 5 strength bilaterally. Next, I'm going to do the same thing for your feet, starting off with your pulses or your posterior tibial. Good. Posterior tibial pulse is 2 plus bilaterally. Your dorsalis pedis pulse. Perfect. 2 plus bilaterally. And then I'm going to pinch your thing real quick. Capillary refill time is less than 30 seconds. Good skin turgor. And no pitting edema is noted. Next, I'm going to ask you to push up with your legs. Good. Now push down. Now kick forward. Now kick backward. Kick forward. Kick backward. Now do that with your toes. Push up and push down. Same thing here. Push up and push down. And go outwards with your legs and push inwards. Perfect. Strength on the lower extremities is 5 out of 5 bilaterally. ROM is good. Skin color is also consistent throughout the upper and lower extremities with no visible erythemas or contusions. And yeah, I'm gonna clean my stethoscope real quick. And before I end off, I'm going to test your sensations. I'm going to ask you to close your eyes, and I'm going to just tap you and let me know whenever you feel it, okay?
Yes. 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 Yep. 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 Yep.
Perfect. Did you feel any numbness or tingling?
No.
Sounds good. Sensation is was felt and good. Thank you. That should conclude it. I'm going to wash my hands first, but do you have any questions for me?
No.
Sounds good. This is your bed tray. There are 2 guardrails up, and this is your call light. And just call me whenever you need me, and I'm going to push this bed to the lowest height. And that's all. Thank you so much.
Thank you.